We're here today to talk about Jon Foster.
You mean Tom Foster?
Who? Am I in the right interview?
Jon Foster?
We're here to talk about Jon Foster.
I think that's the guy that spells his name without an H.
When you think of Jon Foster, I mean, first of all, he's dang good looking. He is one of the handsomest, greatest models I've ever seen. He's chiseled, the jaw, the dimples, the dark hair. Is there another Jon Foster?
Tom Foster, you mean, right? Because I know Tom, great guy. I'm not surprised he'd win an award.
No, Jon Foster.
Really?
Why would you want to talk about him?
The Earl Collier Award is one that is so important because it's chosen by our colleagues in the field. And not only does it reflect professionalism and achievement in the industry, but it really talks about the person. Someone who is totally a person of integrity, a person who employs a servant leadership style, and one who has made significant achievements without necessarily taking the credit for them. Each of those characteristics are reflective of who Jon Foster is.
From the leadership, the service, the quality, it all fits. So I think the challenge for anybody is to be the total package, and I think that's what Jon is.
Well, Jon is very deserving of this award. I've known probably 30 to 40 Earl Collier Award winners. They've all been outstanding, and Jon fits the mold.
Jon is deserving of this award, I think, because he is the consummate professional in the healthcare industry. I've worked with Jon for 15 years now, and I have been impressed with him from day one.
Jon came to the Methodist hospital system in 1986, and it was pretty apparent to most of us that he was going to be a star. Sure enough, it turns out that he has been.
Jon started distinguishing himself in our industry early in his career when he was recognized with the ACHE Young Healthcare Executive of the Year Award.
Well, he was just a kid, and that award is given annually by the American College of Healthcare Executives to persons who are making a name for themselves as young administrators.
He is an exemplary leader, and he is the best kind of leader, which is a leader who gets results.
I recruited Jon because of his outstanding contributions at Methodist when we needed someone of Jon's caliber to come to Baptist. It was an interesting relationship because even though I was Jon's boss, I probably learned more about healthcare management from Jon Foster than anyone I've ever been around, those who I served under and those who I've served with.
He is empathetic to people, he cares about people, and he understands that every individual has dignity and worth, and it does not make any difference what level you are in the organization or what your job is. You are valued as a human being.
He had a tremendous influence on St. David's Healthcare. Jon took what was really a small group of hospitals. He established a vision and a strategy for those hospitals. He was instrumental in establishing the mission, vision, and values for those hospitals. He raised the bar on quality and patient experience and physician relationships, and really turned that into what ultimately became a $4 billion successful healthcare system in Central Texas, which has been award-winning, and today I'm fortunate to be part of, and it's a pleasure for me to be able to follow him.
Being our president and one of the in a partnership environment, what you got to see from Jon is he understood that healthcare is a relationship business, and it's relationships with our patients, it's relationships with our physicians, It's relationships, of course, with our colleagues and employees. It's relationships with our communities. And Jon understood that clearly, and you could see it demonstrated day in, day out in his performance. So understanding that, it made it, I think, really an easy decision for the organization to bring Jon to Nashville and give him a bigger role in the organization.
Jon's not only concerned about his organization. My experience with him has been one in which the entire healthcare field has been involved. He's interested in the healthcare system in the United States, in access to care, in quality care for all individuals.
A perfect example of why he's receiving this award is the courage that he exhibited to reach out and put the St. David's Partnership and Health System on the pathway for the Malcolm Baldrige Quality Award. That's an incredible commitment to do that. You have to be a strong leader. You have to have a commitment to excellence over a long period of time. I think that just demonstrates who Jon is. He's actually committed to the best.
The fact that they won the Baldrige Award, which is very difficult, after Jon left, is both a tribute to Jon's being able to spot and develop talent, but also put in systems, tools, and techniques that are sustainable. Jon's goal is not about Jon, it's about how do we put things in place so when I'm not there, that are scalable, that can be sustainable, and not for him, it's because where he really is committed to is the patient.
Jon is more concerned about how that patient feels, how his or her outcome is affected by what he does than any other administrator I've perhaps ever known.
You know, when I think about people like Jon, it makes me realize that my highly improbable journey from lying in a hospital bed to rising up to be governor of this great state would not have been possible without professionals and administrators like Jon. And just look at some of the roles that he's played. He's been the president of HCE's American Group, the former chairman of the Texas Hospital Association Board, and through these roles and everything that he's done, he's had such an incredible positive impact on healthcare in this state. Speaking on behalf of myself as well as others in this state, I can say that we all owe Jon a huge debt of gratitude for his incredible efforts to improve patient care in the great state of Texas and even beyond.
Jon's extremely well respected both in Texas and nationally. So when people say, well, and sometimes we have this, well, if Jon's doing it and it's working, it must work.
Clearly, he's a businessman, he knows his numbers, he knows all that sort of thing. But what really attracts him to people and physicians is that he's trustworthy, he speaks clearly, he'll tell you the truth in the room, even though people are just focusing on the superficial issue of the day, he'll tell you what the real truth is behind there. And it's that kind of trust that I think is emblematic of Jon's good work that he's done here.
Jon was a consensus builder. He was very concerned about what the other members of the board and the other officers of the association felt.
Having served as chairman of the Texas Hospital Association for the past year myself, I have a greater appreciation for some of the challenges that I'm sure Jon faced during his tenure as chairman in 2007 and 2008. And during Jon's tenure, he was incredibly successful at gaining consensus, bringing disparate views together on difficult issues for the association.
Jon's ability to put people at ease, to essentially help folks see the outcome, the results of working together, it is so effective that I think the medical staff at Baptist looked at Jon and said, we don't have to look at the past, we can look forward, and we can make a difference, and they did.
I think Jon's one of those people you want to be around at work. He's also one of those people you want to be around as a friend.
I've known Jon for over 30 years, and I can say that Jon and I have literally laughed until we've cried, but I can also tell you that we've literally cried together because Jon has been there sort of in the good times and the challenging times. We've been there for one another.
Now, I think Jon understands to truly be successful, you've got to have a balance in life. And he is, of course, highly successful in his work life, but he's also highly successful in his personal life.
There's no more important people in Jon's life than Laura and his girls.
I always felt like his family and his faith were far more important to him than his hospital career. There was never any question about it. He prominently took time with his family, intensely proud of his daughters.
He's a family man, he loves his family, he's a religious man, and it all comes together, and it shows in just, who he is. The decisions we make really reflect who we are, and that just shows in Jon. It just does.
That is tough, because any good leader is multifaceted. I guess I would have to say effective.
Leadership.
Trust.
I would say intense. Jon is intense.
I think the word that comes to mind for me when I think of Jon is character.
Remarkable quality.
Courageous leader.
I could say personable, could say attractive, any number of words come to mind. But he is effective in personal relationships, in running his organization, in his personal life. I think that probably sums him up to me.
Jon, please accept my sincere congratulations on receiving the Texas Hospital Association's Earl Collier Award.
Jon, you're a person of integrity, you're a person of leadership, and you're a personal friend. And what I'll say to you, Jon, is job well done.
Jon, congratulations on receiving this award. You are so deserving. We at HCA are incredibly proud of what you've accomplished and glad to have you as a key part of our team. All my best, Jon.
I'm proud to call you a friend. I'm proud to call you a colleague, and HCA is fortunate to have you on our team.
Jon, congratulations. You deserve this award. This is a very high honor. It is unique to the Texas Hospital Association and Texas Hospitals, which you've been a great part and a great leader. I know when you receive this award, you're going to be very honored, and you should be. I want to say to you, Jon, though, that you're not through.
Congratulations, Jon. Our industry, our association, and our community are better off because of your leadership. Most importantly, Jon, as your friend, I couldn't be happier for you. Congratulations, buddy.
So even though I know you're feeling you don't deserve it, I know you're overwhelmed at some of your mentors that have got this and you can't believe it, I know it's a great honor for you. So what I'm saying today, just once in your life, just say thank you, because you know what? You deserve this, you've worked hard for it, but most importantly, thousands of employees, thousands of physicians, and hundreds of thousands of patients get better care because of you. And on a personal note, I want to thank you.
Jon, there's one thing I want to say to you personally, and that is congratulations on receiving the Earl M. Collier Award for Distinguished Hospital Management. It is for outstanding people, and you are one, and your career has been stellar. Jon, I'm proud of you.